Congressman Kennedy, we want to thank you again for attending the Innovation Recovery Conference this year in San Diego. It's such an honor to have you open up today's sessions.
I appreciate that. Thank you for having me.
Absolutely. One of the things that I was really taken with your talk this morning was how you broke down parity to coverage of the brain. And I think that's such a great analogy. I was wondering if you might just share a little bit more of your thoughts on that.
Well, the brain illness that we have is one that needs to be treated like any other organ illness. And if we do that, we kind of take away the mysterious quality of mental health treatment and get back to how we treat other chronic illnesses of other organs of the body. So I have asthma, I have a high risk for cardiovascular disease. So for these illnesses, we do prevention. We do primary care. We do wraparound support services. If you're a diabetic, you expect all those things from your healthcare system. But when it comes to illnesses of the brain, which are also chronic in nature, we don't have any of those things that we expect in other areas of physical healthcare. So the whole notion of parity means equality between mental health and substance use disorder treatment and medical and surgical treatment. So if you can measure what you do for the diabetic or the cardiovascular disease patient or the cancer patient, then you can compare it to whether you're providing the same level of services, both on the prevention level, on the chronic care management level, and on the acute level, if that's what it takes. So it's a way of framing our cause in a way that gives people something to wrap their arms around, because everyone understands that people are treated if they have a life-threatening illness that's medical in nature. Well, what's more life-threatening than a substance use disorder that gets to be out of control and doesn't get that early treatment that can make such a difference? Same thing that would happen if you had a cancer patient who didn't get treatment until they had stage 4 cancer. That's where we are in mental health and addiction treatment today. We're treated as if we're stage 4 patients, and that needs to change.
You drew a parallel with some comments about how it's been viewed for so many years as moral issues and not the medical issues. Do you sense in this country that we're starting to have a shift in the public awareness that this is a medical issue?
Absolutely. I think that's a big shift in people's mindset if they understand the chemistry aspect of this as opposed to it being a character issue. Because who willingly subjects themselves to ridicule and shame and abandonment and marginalization? I mean, we're all people who want to be loved and embraced and supported. So why would we do something that's so antithetical to our self-interest? Because it's not a choice. When you're active in this illness, you need to have that cycle broken. Now, I'm not here to say that there isn't a kind of a moral or spiritual element to treating these illnesses, because frankly, how we conduct ourselves is also a pillar of our recovery, and we need to have some kind of responsibility. This isn't just a medical issue. It is a medical issue, and it's one where we also have to appeal to people's sense of dignity and justice and their responsibility to other human beings. Because one of the things that these illnesses does to people is it makes them a pariah, because people are basically not fun to be with when they're active in their illness, and they actually end up hurting a lot of their loved ones. And so part of recovery is to change that paradigm, get the medical piece treated, but also treat the spiritual malady, as it's known for those of us who are in 12-step recovery.
It wasn't many years ago, 40 years ago, that Betty Ford first came on the scene to talk about her diagnosis of breast cancer. And that was a life-changing moment, I think, for this country, that a public figure would share something so personal. And now researchers call that the Betty Ford blip, that they've seen the incidence of breast cancer continue to go down because of early detection of mammograms. And it's a nationwide movement. But yet, it was 2 years later in '76 that she shared her struggle with alcoholism. So we haven't had that Betty Ford blip when it comes to addiction and mental health issues. And I'm wondering, you made a comment about
we almost had the Betty Ford blip on alcohol treatment, addiction treatment. You had Senator Hughes from Iowa. You had a whole host of celebrities really work to bring greater awareness. But then it was all dashed in the 80s with this kind of just say no and treat these issues as moral issues as opposed to chronic health issues. But we almost had it.
And I'm wondering now with returning veterans, and you comment on how, you know, the suicide rate with returning veterans is a national travesty. Could the returning veterans be that blip that we're looking for in getting real treatment for these returning veterans that might impact all of our society?
Well, this is a real national security issue. I mean, it's killing people in record numbers. More people die of overdoses than die of car accidents. We are over 40,000 suicides that we know of. Twice what's homicides. I mean, these are startling statistics. Everybody knows this affects them and their families in some way, and yet we put our head in the sand. But we cannot put our head in the sand when we see the shameful statistics of 22 veterans taking their lives every single day in America. It's just a challenge to our own consciousness as a nation that we would allow that to take place under our watch as a nation, so to speak. So we need to change the way we treat our returning heroes and their signature wounds of war, traumatic brain injury and post-traumatic stress. And when we do that, I think we'll begin to change overall attitudes towards other Americans who are also facing stress. It may not be the stress of war, but maybe the stress of growing up in a household where your mother or father were incarcerated, or where there was domestic violence, or there was addiction. I mean, these are stressors on a developing brain, and we understand what post-traumatic stress is for the war zone. But a lot of our kids grow up in war zones, the hail of gunfire in many places in this country. So we can appropriate what we're learning about veterans and apply it to all Americans, because it's a moment where we can have people understand these illnesses in a new light, the one of our veterans, and then use that new knowledge to help all Americans.
You've created a new initiative that I think you're calling the Kennedy Forum, and I was wondering if you might give us a little bit of information and shed some light on your activities in this field through the Kennedy Forum.
So I had the honor of being one of the sponsors of the Mental Health Parity and Addiction Equity Act, but that's a law, but it's not reality. To make it real, we have to implement it. So what I've done on the anniversary of President Kennedy's signing of the original mental health bill, the Community Mental Health Act of 1963, is coalesce everyone who is a stakeholder in the delivery system of mental health to really put together an agenda, a political agenda, as to how do we implement the parity law and frankly change healthcare so that mental health is part of healthcare, right? And the way we do that is, one, we get payers to be accountable. We measure whether they are accountable, meaning whether they're doing medical utilization review for mental health the same as they would for a medical or surgical issue. That's what the law requires. But then we need to make sure payers and providers, those that are providing this care, are accountable to standards, just like they would be if they were part of any other medical profession. We have to integrate with social services because these illnesses require support services, housing, and supportive employment. We need to seize the day on modern technology, which gives us new tools to help treat these illnesses. And we need to ultimately act to prevent, because the best treatment is prevention. And there are sound, definable public policies that can be put in place that reduce the total number of people who have mental illness or addiction simply because we take proactive, preemptive steps. And those are not policies that we currently embrace. So the concept is we need an agenda. So it's the Kennedy Forum kind of as a way of building a political agenda. If you care about mental health, here are the issues that you can work on depending on what your area of expertise is or your interest.
You know, as you know, Foundations has been working hard over the last couple of years to establish ourselves as a center for excellence. And, you know, we have Siobhan Morris as our Director of Research, and so we've been working hard to develop what those pieces are that we're going to be able to reflect back and report back, to the payers. And I would love your comments on if you believe that those efforts that we're doing around the Centers for Excellence, is that what you think the industry is looking for?
Well, Foundations has done something unique, and that's to hold themselves accountable to the scarce resources that they have to provide life-saving treatments. And we need to be, fiduciary responsible for the lives and the dollars that we have. We can't squander these dollars. There's not enough of them. So the notion of trying to do what works, we don't have time or an ability to leave these people to die. We have to save them. And I love the fact that Foundations is really developing those benchmarks that can be used to determine whether we are really delivering the best in care based upon what the evidence tells us and our experience tells us. And so that moves the whole field forward. So I appreciate what you all are doing. It's an important job, and our field needs it now more than ever. Now that we have dollars coming, people are going to insist, what are those dollars paying for? The fact that we're not just taking them for granted, but actually saying, no, you're required to pay us for these services, but guess what? We're going to demonstrate to you that what you're paying for actually produces good outcomes. What a revolutionary concept.
Absolutely.
Great job.
Thank you. And I think that the audience today really heard that call that you made, that challenge you made to all of the treatment centers that are here this week, that they need to own their piece, of setting those benchmarks. So.
Right. Well, the only way we're going to expect to win at this fight down the road is by demonstrating that we're worthy of the kind of support that we're beginning to get in this field. If we are not proactive, then we'll end up sabotaging this wonderful opportunity we have to finally get dollars into the field of substance use disorder treatment and mental illness treatment. And we cannot afford to lose this one opportunity that we have.
Congressman Kennedy, thank you so much for being with us here in San Diego. Really appreciate your time.
We're all in it together.
Thank you.
You bet.